Welcome to the sleep test training. The goal of this presentation will be to explain and guide you through every step of the sleep recording device installation. We will also go through the questionnaires that we will need you to fill. At the end of your appointment with the sleep technician, you will be given a case containing everything that is presented in this video. Let's start with the 3 enclosed documents. Read through and fill each one of them as they will serve as foundation for the interpretation of your test. They also contain important information and reminders. The first questionnaire gives you some details needed for the test and contains a second part, which you will need to complete the following morning. The second questionnaire acts as a sleep diary. It is divided in 3 distinct parts. This information will provide us with examples of your sleep habits and will give you a chance to detail some symptoms or difficulties you may have encountered. It will also assess your daytime drowsiness. Fill it to the best of your knowledge. The third document is an illustrated step-by-step installation guide. Once completed, put your documents back in the bag. To complete your sleep recording and guide us toward a diagnostic, you will need to put on the recording device as well as 4 sensors. The first 2 sensors are elastic bands. One goes around the chest and the other one fits around the abdomen. Both bands are not equal in length, and you will need to identify which goes up and which goes down by looking for their identification at one of their extremities. They will record every breathing-related movement. The third sensor is the nasal cannula. It will be needed to monitor the airflow associated with your breathing. The fourth and last sensor is the pulse oximeter. This will record the oxygen level circulating in your blood as well as your heart rate. Please note that everything is already programmed, plugged in, and ready to record your sleep patterns. All you need to do is install the recorder and its sensors. Let's start the installation process. When you are ready to go to bed, reserve 5 minutes for the installation. Please keep in mind that we will need a total of about 6 hours of sleep recording for a successful analysis. First of all, you will need to wear a t-shirt or pajama under the equipment. Then, place the recorder flat on the lower chest part. Make sure it is centered as it will ensure a better reading of your sleeping position and a more precise diagnostic. Use the large strap to go around your body, back into the hoop, and use the Velcro extremity to secure the machine tightly in place. Note that the front display will never turn on or give any information about the recording status. Please do not press any of the buttons. Everything is pre-programmed and will record automatically. Once this is completed, the next step is to install 2 elastic bands for respiratory effort monitoring. Identify the first band on which the word thorax and a blue square appear. Install it with the dark side facing the clothing, going around your back so the plastic extremities come in front of your body. Align the clips carefully and press down until it snaps. This band works best if installed directly under the armpit on the upper part of the chest. Now take the second band labeled abdomen with a yellow square and install it in the same way you previously did with the thoracic band. To obtain an accurate reading, this band is best positioned leveled around the waist, a little bit over the belly button. Getting an accurate measure of the respiratory flow is the most important part of the recording. This is done with the nasal cannula. Pay close attention to the 2 prongs at the end of the cannula. You will notice that they are slightly curved. Hold the cannula so the prongs are pointing up toward the ceiling and the curve down towards you. Insert the prongs into your nostrils. Place the cannula in as far as it will go. Lift the tubes on each side and fit them over your ears, looping them back under the chin. Move the slider up the tubes to adjust the fit. Once everything is in place, secure the cannula with 2 small pieces of tape. Place them over the tubes on each side of the nose. This will secure the cannula in place through the night. The last step is to place the pulse oximeter. Install the clip on the desired hand, avoiding using the thumb or pinky finger. Simply insert 1 finger in the clip until it reaches the end. Make sure the cable comes out over the hand. Use a piece of tape to secure the cable on the finger Then place a second piece a little further on the end. Please remove nail polish and any type of artificial nail as it will greatly degrade the readings. This completes the installation and you are now ready to go to bed. Even with the sensors in place, know that you are free to move around the house if you wake up. You may even remove the pulse oximeter if you need to go to the bathroom, or the nasal cannula if you need to blow your nose. Just don't forget to put everything back in place, including the tapes as soon as you get back to bed. Thank you for your collaboration.